So we're going to take a look at lower limb anatomy, focusing on the musculature, and we're going to do this with a bit of massage as well, because that helps us to palpate the tissues and we can be a bit more accurate in terms of what it is that we're actually interacting with. So we're going to begin with the hamstrings. With the hamstrings, we've got three: the lateral, biceps femoris, biceps meaning two heads, femoris just of the femur. That's the only lateral muscle of the hamstrings. We've got the two medial hamstrings, which are the semimembranosus and semitendinosus. Interestingly, about the hamstrings group, we've got 2/3 of the muscle mass on the medial side and only 1/3 of the muscle mass on the lateral side. Why would that be? Well, we need more strength to bring us into a protective position, i.e. the fetal position. And you'll find that same pattern illustrated as we come down into the lower leg, where we've got the fibula, which is about 1/3 of the bony space of the lower leg, and the tibia, which is 2/3 of the space. No surprise there then that biceps femoris inserts onto the fibula and the two semi-muscles insert onto the tibia. So they cross the knee, and we've got a big, strong tendon up at the hip end, just under the ischial tuberosity. So somewhere in there, and we can feel that one tendon that all three hamstrings share onto the sit bone or the ischium, just into there. As we come around to the side, we've got the iliotibial tract. That's always going to be slightly painful to palpate just in there. So I'm using quite broad thumbs. The job of the iliotibial tract is to stabilize the lateral knee. So it's going to cross the knee. It comes from the TFL muscle and glute max. So it's the only structure really that has the origin of muscles. That's going to come down across the knee and actually insert into the tibia. So the two muscles that insert into the ITB then, we've got TFL, tensor fascia lata. Does what it says on the tin. It tenses the lateral fascia, with the lateral fascia being the ITB. We then got glute max, which everybody knows as the bum. It's the big glute max, biggest muscle fiber for fiber in the body. Those two work together to insert into the ITB. Interestingly, again, they are antagonistic to each other in every way. TFL abducts and flexes the hip, whereas glute max abducts and extends the hip. TFL medially rotates the hip, glute max laterally rotates the hip. So they are antagonists almost in every sense, and we do need a good level of balance between the two to give us good function of the ITB. So if we were to take off some of the layers here, under my hands we would have adductor magnus, which is the biggest of the 5 adductor muscles. It's often called the fourth hamstring because of its shared insertion or origin point with the hamstrings at the ischial tuberosity. We've got a couple of other adductor muscles in there as well. We've got adductor longus and adductor brevis, as the name would illustrate. They are slightly shorter than adductor magnus, which is magnificently big. We've got 2 more muscles in there as well, the adductor group, to make up the 5, pectineus and gracilis. Now, gracilis is a muscle that I really do want to talk about because we've mentioned the hamstrings group. We've had biceps femoris on the lateral side, semimembranosus, semitendinosus, and then we've got gracilis as we come around. Why did I mention the hamstrings group there? Gracilis and semitendinosus share an insertion point just around underneath the knee at the pes anserine, along with sartorius. So 3 big biaxial muscles, and they share the same insertion point. Now, the really interesting thing about the shared insertion point of these 3 muscles is that they all originate at different bone of the pelvis, with sartorius originating at the ilium, gracilis originating at the pubis, and semitendinosus originating at the ischial tuberosity. So further into the back of the knee, we've got popliteus. So popliteus occupies the popliteal space, which is just the space that we call the back of the knee, along with arteries, veins, and the sciatic nerve, where it branches off into the common perineal and the tibial nerve. Popliteus is in there. It's a weak knee flexor. It stabilizes the lateral, or the posterior knee rather, and it unlocks a fully extended knee via terminal rotation, which is tibial rotation, which the tibia does do to some degree medially and laterally. We've got plantaris in the back there as well, so a vestigial muscle. Not everybody's got it, and those that have will have different levels of development. It's got a very small muscle belly just up behind the knee, and a very, very long tendon that comes all the way down and kind of wraps around soleus. Underneath, or distal to plantaris, we've got the calves. So the calves, we've got gastrocnemius. Everybody knows that as the calf. It's the big biaxial muscle of the lower leg. We've got the medial head, lateral head, and that crosses the knee. So those heads insert into the medial condyle of the femur and the lateral condyle of the femur. The insertion point is down at the Achilles tendon into the calcaneus, and there are a few other muscles that share that same tendon. So we take gastrocnemius off and we're left with soleus underneath. Soleus is actually a bigger muscle than most people think. It covers most of the same space that gastroc does, but just slightly deeper to it. It does not cross the knee, which means that if we want to isolate it away from gastrocnemius, all we need to do is flex the knee. Gastrocnemius there via its origin is relaxed, and we can more accurately get into soleus, and we can also work it if we need to in that position. So we've removed gastrocnemius, we've removed soleus. Underneath there, then we've got two quite surprising muscles in flexor hallucis longus and flexor digitorum longus. So would you have ever guessed that they come up so far when all they really need to do is flex the toes? No, me neither. And I'm always forgetting about them, but they are in there. Underneath them, we've got the deepest layer of posterior lower leg musculature, which is tibialis posterior. It's in there, we can't palpate it. We can palpate the tendon, which is somewhere around the medial side, but apart from that, you just have to know that it's in there and trust in your anatomy. Speaking of tibialis posterior, there's a way of remembering the three tendons that come in between medial malleolus and calcaneus. We call those Tom, Dick, and Harry. Tom, T, tibialis posterior. Dick is flexor digitorum longus, and Harry is flexor hallucis longus. So those three tendons go in that order between medial malleolus and calcaneus. As we come around to the lateral side of the lower leg, we've got the peroneals. So also known as the fibularis muscles, which actually makes a lot more sense because they connect to the fibula. We've got peroneus longus and we've got peroneus brevis. So why have we got two? Well, the body doesn't duplicate, it's not daft. We have different insertion points. Brevis is going to insert onto the tuberosity of the fifth metatarsal, and peroneus longus is going to come underneath, help to form the arch of the foot, and onto the base of the first metatarsal and the medial cuneiform, giving us some of the support of the arch of the foot. So further down into the foot, and we've already mentioned some of the flexor tendons that we've got there. I think the most important thing to mention here is the shared origin of some of the flexor tendons into the anterior calcaneus. So I mentioned that because you may have heard of plantar fasciitis. It's inflammation, irritation, and weakness of the tendons just in there. So if anybody's got that, don't do this because that's going to be painful. They need to strengthen that, usually with some kind of calf raise combined with toe extension. So we mentioned glute max earlier on, but let's remove that and look through to the deeper layers. We've got glute med, gluteus medius, just up in that top corner. Very important muscle for hip stability. We're stood on the left leg, then this glute med is going to have to be working to keep this hip in relative abduction. We spend a lot of time on one leg, i.e. walking or running, so that's working a lot, and if it's dysfunctional, it could be affecting the hips and lower back. Take that one off, and underneath, just tucked in somewhere in there, we've got gluteus minimus. Easy to remember what it does, exactly the same actions as TFL. Abduct, flex, and medially rotate the hip. Just distal to those muscles, we've got the deep lateral rotators. So glute max laterally rotates the hip, but we've also got a set of muscles just underneath, which I refer to as the rotator cuff of the hip, because they give us stability of the ball within the socket. Piriformis, the two gemelli, the two obturators, and quadratus femoris. Looking at the anterior aspect, we've got a group of four muscles on the front of the upper leg we call the quadriceps. Quadriceps meaning we've got four muscles as part of that group. We've got the vastus group, which are vastus medialis, vastus lateralis, and then underneath the bigger of the four, we've got vastus intermedius. Those three only cross the knee, so they can only act on the knee. They're at the front, so they extend. On top of those, we've got rectus femoris. Rectus femoris, a biaxial muscle, so more prone to injury, stronger and more powerful. That crosses the hip, comes from the AIIS, anterior inferior iliac spine, all the way over the top of vastus intermedius, into the quadricep tendon, along with the other three, over the patella, into the patellar tendon, and then into the tibial tuberosity, just there. Along the front of the lower leg, we've got tibialis anterior. So tibialis anterior is on the tibia, it's at the front, and of course it crosses the joint at the front. The way it acts on that is to move insertion closer to origin, and it dorsiflexes. The interesting thing about tib ant is that it has the same insertion point as peroneus longus, although they take a slightly different route to get there. So these two do have that same antagonistic relationship as TFL and glute max would on the IT band. Other muscles in the area not to be forgotten. Just like with the flexor tendons of the toes, we've got the extensor tendons of the toes as well. They are in here, and they are surprisingly proximal. We've got extensor hallucis longus, and we've got extensor digitorum longus. Last but not least of the hip, we've got the hip flexors. There are many muscles that flex the hip, but the two that we're going to talk about up here are the psoas and the iliacus. So these two converge into the iliopsoas tendon and insert down at the lesser trochanter of the femur, with the psoas coming all the way up to the lumbar spine, attaching to the transverse processes and bodies of the lumbar vertebrae L1 to L5, and provide a good degree of core stability, as well as hip flexion and some other actions. I hope this has been helpful, and you can comment and like and subscribe. It helps the channel and it helps me make more videos like this that hopefully help you. Bye for now.